Liphuthuma isikhathi ithimba iAfrica Vaccine Acquisition Task Team ukuze liqhamuke nohlelo lokuthola imigomo kwelizwekazi. Kube nezikhalo njengoba kunokusaba ukuthi lelizwekazi lizosala ngemuva. Usihlalo weAfrican Union ugxeke kakhulu amazwe athenge imigomo ngobuningi okwedlula amazwe ampofu. Amazwe akhiqiza imigomo kanye nemishanguzo nawo axakiwe.
The developed north, which has substantial financial resources, has purchased the largest stocks, while we in Africa are struggling to get our fair share.
Unxuse inhlangano iWorld Trade Organization ukuthi ingenelele.
We are calling on the World Trade Organization to waive specific TRIPS obligations related to the prevention and treatment of COVID-19 for a defined period. We need more countries to support this initiative. This would enable countries in Africa and elsewhere to access active pharmaceutical ingredients and benefit from technology transfer, including the know-how to manufacture vaccines in Africa at a much cheaper cost.
Kuze kube manje izwekazi Africa isikwazile ukuthola imigomo ngohlelo lwenhlangano yempilo emhlabeni iWorld Health Organization olwaziwa ngeCOVAX.
We appreciate the offer that has been made by MTN, a mobile telephony company on the African continent, to donate $25 million to the vaccine program of the Africa CDC to immunize health workers on our continent.
Abantu base-Afrika babheke ngabovu ukubona ukuthi ugomelo iCovid-19 kuzoqala nini.